Why am I having abnormal vaginal discharge at all time, doc? Why is it that every time, every month, I'll be having abnormal vaginal discharge? Now, I want to tell you there are several reasons why a lady may have abnormal vaginal discharge. It may happen maybe once in a year or once in 5 years, but persistently having abnormal vaginal discharge in a woman means there is a problem, and there are a lot of factors which I am going to share with you in this video which may cause any lady to have abnormal vaginal discharge. I want to welcome you at this time on this channel. If you are first time meeting me, my name is Dr. Chidebereze, and on this channel we discuss about health issues, importance of exercising, and other relating important issues within our society. So today this is an important topic which every lady should listen to. Please, if you have not subscribed to this channel, I want to plead with you to subscribe at this point in time. Just click on that subscription button at that place, subscribe, and then turn on your notification button so that anytime we are placing any video, you will be meeting our videos. Thank you as you do that. Thank you so much. You're welcome back. You're welcome back. Now, concerning abnormal vaginal discharge, that is a recurrent or persistent abnormal vaginal discharge, you must understand some certain things first. Number one is that for you to have abnormal vaginal discharge, it means there is either affectation of the vagina itself or the cervix. Cervix is entry point of the uterus, otherwise called the womb, or there is affectation of the womb itself, that is uterus, and in some cases affectation of the fallopian tubes, just as I seen on the screen. So infection of any of these tissues or any of these spaces can cause you to have abnormal vaginal discharge or inflammation of any of those areas. You understand? Now, I have made a video concerning toilet infection and PID, that is pelvic inflammatory disease. They are all in the description button. And in one of those videos, that is in the toilet infection itself, because I made the video before now, so that people can understand that there is a difference between what people call toilet infection and abnormal vaginal discharge. In short, toilet infection does not exist in medical terms. In reality, it does not exist. So I made those videos so that you can understand some of those issues. Now, in that video concerning toilet infection, I discussed what is called normal vaginal discharge. What should be normal? Do you understand? So if you watch the video, you will understand what I mean by a normal vaginal discharge. In essence, a normal vaginal discharge should not be smelling. That's the hallmark of it. It should not have a bad odor. That's the hallmark of it. Now, moving forward, having understood this background, what are the things that can cause a lady to be having every week, a woman be having abnormal vaginal discharge? One of the reasons, one is recurrent use of antibiotics. Use of antibiotics at all time for anything. There are some ladies, for any fever, they are already on antibiotics. For any cough, they're already on antibiotics. So if you are using antibiotics at all time, those antibiotics you are taking, they are going to go down to kill the normal flora, that is the normal bacteria that exists in your vagina. So when they kill the normal bacteria, otherwise called the normal flora that exists in your vagina, what will happen is that you now begin to have yeast, that is candida, begin to grow. You begin to have what is called vaginal candidiasis, which is one of the abnormal vaginal discharge. So you should not be using antibiotics frequently. In short, in a normal sense, you should meet a doctor to prescribe antibiotics for you for any reason. You understand? So if you have any cause to take antibiotics, meet your doctor, or don't take it for a long time, or don't continuously use antibiotics for anything, any fever antibiotics, you'll be having abnormal vaginal discharge, which will be recurrent because of distortion of your normal flora. One reason, as we discussed. Now, the second reason is what is called recurrent douching. That is, some ladies used to introduce some substances into their vagina. Some used to introduce cream, perfume, water, and different things into their vagina. When you introduce those substances, they are going to deactivate the normal flora that you have and cause an abnormal bacteria or abnormal fungi or any other thing or viruses to begin to grow within your vagina. Do you understand? So introduction of foreign substances into the vagina by douching, recurrent douching, can cause you to have abnormal vaginal that is recurrent. Do you understand? So a lady should not even, you are not supposed to wash inside of the vagina with anything. You are supposed to just wash the outside part of the vagina, that is called the vulva, because the vagina itself has a mechanism, has a system of washing itself naturally. You don't need to wash it. So introducing substances into your vagina can cause you to be having recurrent abnormal vaginal discharge. Another thing that causes you to have abnormal vaginal discharge that is recurrent is what is called poorly-treated PID. There are some ladies, immediately they have abnormal vaginal discharge, maybe they have pelvic inflammatory disease or any other thing coming out of their vagina, they will run and go and do one or two tests and say that they have infection and start using antibiotics. My dear, because of those antibiotics you are taking, in some cases the antibiotics you are taking is not specific, is not actually made for that particular organism that is growing in your vagina or that is growing in your uterus or your pelvis. So using those antibiotics will not actually help you. So those bacteria that are growing in you begin to develop what is called resistance. So by the time they will develop resistance, if you now start using any other drug, it will no longer work. Do you understand? That's why you should meet your doctor if you are having abnormal vaginal discharge, so that they can do some certain things, some clinical examination for you, and also send you for some tests. Do you understand? There is a test that is called high vaginal swab, MCS, or endocervical swab. They can also be done for you so that they can be sure of the particular organism that is growing in you that is causing to be having PID, that is pelvic inflammatory disease. So these are some of the reasons that you are having abnormal or recurrent abnormal vaginal discharge. Now another reason is whereby you are having what is called multiple sexual partners. There are some ladies, they have multiple sexual partners, or you are faithful to your partner but your partner is not faithful to you. So because of that, you may continuously be having abnormal vaginal discharge because your partner used to go out to have sex and also come back to have sex with you, especially unprotected sexual intercourse, causing you to be having recurrent infection. So those recurrent infections you are having can cause you to be having abnormal vaginal discharge that is persistent. Do you understand? So these are some of the reasons that you may be having. So now, going forward, if you have what is called a partner that is not treated, a male partner that is having abnormal penile discharge, abnormal urethral discharge, that person can also infect you. So as you're treating yourself, assuming you have PID or abnormal vaginal discharge, you should also treat your partner, not only you. Do you understand? So in the real sense, if a woman is having abnormal vaginal discharge and the woman is having one partner, that woman should also be treated with her partner. So you don't just come to the hospital to treat yourself, assuming you are faithful to your partner. You should also call your partner so that both of you can be treated, so that you won't be having recurrent or persistent abnormal vaginal discharge. Kindly subscribe if you have not done so at this point in time. Please subscribe and then turn on your notification bell so that any of my videos I'm going to be posting, you'll be getting it. Now another reason, one of the major reasons why some ladies have abnormal vaginal discharge without knowing is that they have what is called immunosuppression. If you have immunosuppression for any reason, maybe you have HIV, that's a human immunodeficiency virus, or you have diabetes, you may be having recurrent abnormal vaginal discharge because your immune system is low. So these are the major reasons why some ladies have abnormal vaginal discharge. So just to recap, you have about 6 factors, 6 main reasons why some ladies have abnormal vaginal discharge. And I want to thank you for listening today, and I wish you can help me to share this video so that other people can listen to my video. Remember to drop your comments, drop your questions, and then like this video. Thank you so much. Thank you.